Dr. Theocharides, let's talk about liposuction, and especially let's talk about liposuction basically while staying awake. Maybe many of us didn't know that, at least in, as of lately, I mean, early on, people were basically put asleep, I guess, and now that's not the case anymore. So tell us about the kind of newest form of liposuction. Why is it better? What can it be used for, and stuff like that?
Yes, again, newer technologies, more advances, better safety, better results. I think that's the key. The traditional liposuction, what most people think of liposuction, they see a patient who's under general anesthesia, and they see the whole body practically shifting left and right while the surgeon is operating quickly to remove fat. The advantage of being awake, many advantages. Number one, you don't have general anesthesia. You don't have the risk of general anesthesia. You're never really totally paralyzed, so that the risk of blood clots is much less. It's actually more comfortable afterwards because the local anesthetic that we use lives in the body for at least a day or so it gives more comfort. The tubes called cannulas that we actually remove the fat through are tinier, so we can be a little more precise, I believe, in our contouring. During the procedure, I'll have my patients stand. We compare one side to the other. We feel, we interact. So it's a constant communication type of thing that we're actually being able to optimize and almost perfect the whole procedure. So there are many advantages. And the local anesthetic, we even put a substance in it that minimizes the bleeding. So people are losing literally teaspoons of blood instead of cups of blood as the traditional liposuction in a person asleep. So wow. It's a little more time consuming. Yes.
No, I just said, wow, that's quite something. I mean, teaspoons of blood versus cups of blood. I mean, I didn't even know one loses so much blood or did lose so much blood with liposuction.
See, the challenge when you're awake is you don't want to be, spending hours doing a procedure because of the depth of anesthesia. But in an awake patient, you can take your time, take it properly, carefully interact with the patient, adjust things accordingly. So it's overall a better experience and a safer experience for the patient.
Well, even though it takes a little bit longer in terms of time, let's say a couple hours or whatever instead of an hour, or I don't know. Or, depends on what you do, I guess, right?
Right.
Right. Okay, well, wonderful. Now, and again, a burning question, at least to me, and once a person does a liposuction, how long will it take? Let's assume the person does not change his lifestyle, which is almost a given. Because if we could change lifestyle, maybe we would never need a liposuction. So that's my personal feeling. I'm not so sure, but that's true. So let's just, a person keeps eating pizza at 10 o'clock at night and then, watches a movie and goes to bed. So, it doesn't change that lifestyle. More or less, what does it take till that fat comes back, till that love handle comes back?
Well, that's a very good question, a very common question. Is this a permanent procedure? I think the way to look at it is when we remove fat, whether we suction it out, destroyed by laser heating, whatever way we do, that fat is permanently gone. That fat itself never comes back. Now, if a person
well, of course not. It's in the garbage can.
Yes.
Well, but the new fat growing I'm talking about.
If a person is going to gain weight, in the vast majority of cases, it will obviously grow in every area. In those areas with liposuction, it seems to grow less quickly or less pronounced, and that's because we've removed a portion or a percentage of those fat cells. If we remove 50% of the fat cells from the upper abdomen, and the person is going to gain another 20 pounds, they will gain some in the upper abdomen, no doubt, but it'll be proportionally less because they have less fat cells after the procedure.
Ah, I see. So basically there are fat cells in the body, and they themselves are subject to grow, a little bit like a pig. There it is. So you take those fat cells, those pigs out, and then there's nothing there to grow in the first place.
There's fewer of them, so the impact of weight gain is less in those areas that we liposuction.
Highly interesting, highly interesting. I wonder whether people out there knew that.
I should mention that, liposuction needs to be considered a body contouring procedure. It's not a weight loss procedure. Now, in particularly heavy people, we could be removing 5 or 10 pounds of fat, but you don't remove 5 or 10 pounds from a person who's 125 pounds. Usually when you're removing 5 pounds or more, usually it's a person that, is carrying a significant amount of weight and fat or adipose tissue. The purpose of this, we contour. Now, even a person who's heavy may be a candidate for liposuction. By removing a certain amount of fat and helping that contour, that could be just the boost someone needs to really get them motivated or to maintain their program of exercise and nutrition so that they continue their journey on towards a healthier body and a better looking body.
So contouring, obviously, you have a little, flappy hanging here or in the, on the thigh, wherever they're hanging down, they love handles on the side. So what about, the guy where, and probably women also, but at least in guys, there's that small little beer belly, even for people who don't drink beer as such. So with, that little overhanging, the belt is kind of a little below, you get the picture, right? Would that be considered contouring? Is there something a person can do, or no, that's it's a different animal that doesn't work there?
That's a very good question. We have to differentiate two kinds of fat. There's the visceral fat, which is inside the belly, below the muscle layer, and there's the more superficial or subcutaneous fat that's between the skin and the muscle. Body contouring, liposuction, will lessen the space between the skin and the muscle. But if there's fat below the muscle, obviously we don't reach it. We're not going inside the abdomen. And it's interesting that you mentioned this. I had this one woman, she had liposuction. She was very pleased. Her husband said, "Hey doc, I got this belly. What could you do?" And sure enough, he looked like he was 10 months pregnant. When I felt his abdomen, there was very little between the muscle and the skin. It was all inside. Can't help that with liposuction.
All right. Again, candid, forward information, absolutely wonderful. Thanks a lot, Dr. T.
My pleasure.
We should call you Dr. T instead of pronouncing your full name. How do your patients call you?
Dr. T.
Yeah, I love it. I'm glad I came up with it. Thanks. Bye-bye.
Thank you. Take care.